Definitely the most positive thing that I've seen is that the patients are actually really taking much more ownership of their diabetes. And I think we as a surgery become more aware of our diabetic group.
I guess the biggest positive change I've seen from this project is the flexibility that people have to receive the services that they need with the allied health professionals.
Patients feel like they've got somebody on their side, someone who will listen, someone who will walk the path with them, and they're really taking it on and I suppose committing themselves to their care. Is CDMnet, which I absolutely love. It's the first time I've ever got satisfaction out of doing care plans for patients. It's just an amazing IT tool, and I feel there's so much depth in it, so much communication with the allied health providers that I'd hate not to have it now. It's just been wonderful, and I just can't imagine life without CDMnet now.
I found it so beneficial to be able to download, to have access to that information right then and there. That information is live. So if I know that if I'm writing in the patient's notes, then that information is going directly to the doctor or to the practice nurse or whoever may need access to that information on that very day, which I think is very beneficial.
During the pilot process, we've actually seen a lot of the patients take ownership of their own health, which has been fantastic.
Trying to make the patient contact us, not we contact them. I think we've got to be equal. Instead of just having us contact them, they need to contact us as well. That's what I've been telling my patients. Try not to wait for us to call you, but you ring us so we can see you as well.
It's very hard to get people motivated to make change. And lifestyle changes particularly, everyone believes that they're going to live a life a certain way, and suddenly we come along and say, right, no, we want you to change what you've thought for years and do it our way. So involving them is a really important part of being part of this program, because gosh, they've got access to their notes that, have always been sort of a bit of secret squirrel stuff in the past. So by them being involved in their lifestyle changes, being involved in that team, they're more likely to make those lifestyle changes. And we've seen some great outcomes from patients that have been involved in this project.
Because the notes are public to a point of view to other practitioners, you're spending a lot more time on these things. You're being a lot more thorough, which isn't a limitation, but from a time perspective probably is.
Definitely, I think the thing I've learnt the most is that I don't know much about diabetes. I think the greatest insight for me was to find out that I really am out of touch with all the latest things. And so for me, probably the most positive outcome has been learning a lot that I didn't know, and I didn't even know I didn't know.
I guess as we're sort of moving into the pilot and we're starting to get results back, it's really positive to see that there are some benefits happening from that.
I think I've involved Allied Health a lot more and have much more communication with them and can get a lot more help from them. That I think is number one. I'm using drugs I never have dared use before, but now I feel a confidence to use drugs that I haven't used. And I think probably I have handed more ownership back to the patient than I did before, because now they seem to, I'm giving them more of awareness of why they need to be doing that.
I check everything. I drill them on the HbA1cs, the cholesterol as well, because they're important as a podiatrist, especially with the circulation as well, and with the neuropathy. I'm
seeing the patients a lot more. Because I have CDMnet, I can see where I'm at with a lot of them, and so that would be the main difference.
This way I think that we're all on the same page. We're all treating people the same. We're all giving them the education and our experience and expertise. but we're treating them holistically. So I'm not just coming from the diabetes educator side of things, I'm thinking about their feet more and, oh gosh, have I made sure that I have seen the podiatrist, and now, well, what did the podiatrist write? And I can then talk to the patient again about what the podiatrist might have said.
I hope that it will become the future for how the enhanced primary care can be delivered.
As healthcare professionals, we want the best outcome for our patients. We want them to be healthy. We want them to walk out of here smiling and thinking, my goodness, I have something to go with. This project allows that.
I'm really excited by the results we've had in our practice, and the most uncompliant patients who I thought would never enrol are just moving leaps and bounds. I'm just really hopeful this will extend so that we can do the same sort of programs for cardiac, chronic obstructive airways disease and so forth, because it just got such potential.